Hi, I'm Dr. Marina Ambridge, and I'm a different kind of dentist. So dental schools, they teach this reactive model of dentistry. So basically a dentist will find a hole, they'll fill the hole, they'll find a crack, they might put a crown on it, but they don't really spend time figuring out what really caused that problem to begin with. So it's not that easy to do that. I've taken over 1,000 hours of continuing education to really be able to take the time and diagnose the reason that something like that is happening in the first place, so that we can prevent that from occurring again and again. So for example, if you were to come in with a tooth that's broken, of course we would fix the tooth, but aside from that, we need to figure out what has caused that tooth to break in the beginning. Is it not enough structural integrity of the tooth, or is it something to do with your bite or the way you're chewing? Because if we don't address that, you're gonna keep coming in with more broken teeth. Rather than just fixing the hole or fixing the crack, we are able to diagnose what is causing those issues to begin with, and then we can address those underlying problems and help the patient develop a treatment plan where those issues are addressed and they're not facing those same concerns again and again. When we see a new patient for a complete exam, we typically devote a full hour to gather records of the patient so that we can diagnose them in different conditions. So we usually categorize conditions of the mouth into 4 categories. So whether it's the gum or the bone, whether it's the tooth or its structural integrity, things related to the TMJ or functional problems, and aesthetics. And then we can generate a risk assessment for the patient where they can see where they stand on those different categories. And then we can make a plan for that patient where we can minimize their risks, or at least make a plan of what they can do to minimize the effect of those risks. Dental hygiene and periodontal disease are a very commonly commoditized aspect of dentistry, where people are just coming in every 6 months because that's what insurance covers, and not necessarily being given enough time to really deal with the underlying issues. So having your gums bleed, while a lot of people think it's normal, it's definitely not normal. Your gums should not be bleeding when you floss or brush. It's not because you're flossing too hard or you're pressing too hard on the tooth. It's actually a sign of inflammation in the gums. It's a sign of gum disease when you have bleeding gums. The blood or the swelling that occurs, it's an inflammatory reaction of your body to the bacteria that are present in your gums. And it's not just about a risk of you losing that tooth in the future. What's more important is right now, because your gums are bleeding, your capillaries are all wide open, and those bacteria are getting into your bloodstream, and they're affecting all these different body systems that you have, and they have been linked in research to over 60 different conditions in your body, whether it's diabetes, heart disease, Alzheimer's, pregnancy complications, a lot of things that are really common in the population. Certain conditions, for example, where you have your immune system weakened, such as cancer, even people will need to have dental clearance to be able to undergo treatment or undergo surgery. But even if your immune system is strong, it doesn't mean that you need to ignore these issues. So if we have patients coming in where their condition has not been corrected, where the gums continue to bleed despite them coming in regularly, it's important to create a customized periodontal program for them. We need to also do some additional testing. We typically will take a saliva sample to evaluate the species of bacteria that are in their mouth, if there's anything specifically tenacious, as well as their immune factors. And then based on those tests, we can create that customized program and target specific antibiotics potentially to help manage that disease. Something like cavities, for example, it's not, there is the broken tooth the broken tooth structure that we need to fill, but aside from that, it's a bacterial infection in the mouth. There are specific bacteria that are causing cavities. And if we don't address why those bacteria are overgrowing, we won't be able to cure you. You're just gonna keep getting cavities year after year, again and again, and keep getting fillings, but eventually your teeth will get destroyed. When I was little, I used to think that, I would get a cavity and it doesn't really matter because they're just gonna fill the tooth and now my tooth is whole again. So in reality, your tooth is never gonna be the same. It's never strong as it used to be before you got the cavity. So once you have some work done on your tooth, you lose some tooth material and you'll have something put in that will never be as good as what your tooth was like originally. And that's why it's important to also get good quality dental work. First, you want dental work that's going to minimize tooth loss or tooth structure loss by having it minimally drilled into, and also something that's going to last, because every time you have to get additional dental work, you lose more of the structure of the tooth, or if you had dental work that wasn't very careful to begin with, you lose tooth structure that you'll never get back, and that tooth will be weaker as a result. If you get a filling that's not very well done and it falls out, that's actually not the worst that can happen, because at least that filling fell out and you know that it's a problem. The worst thing is if you get a filling and it's not falling out, but it's leaking and you're getting decay under it prematurely. And it's not really your fault that you're getting it. It's just there's little micro gaps between the filling material and your tooth that bacteria can easily invade, and you may not know about it. And then when we have to finally fix it, we have to remove a lot more tooth structure because it's damaged from all that bacterial leakage. Once your teeth suffer enough structural damage, you won't be able to hold that tooth together anymore, and you won't be able to fix that tooth with the filling anymore. At that point, you may be able to get a crown, which would be hugging the tooth all around. So for a tooth that's structurally damaged, the crown would be able to hold it together. However, if your tooth is damaged beyond being able to do a crown, then that tooth has a very poor prognosis, even with a crown, and you may need to have that tooth pulled. So even with crowns, it's really important to have them done properly. It's very common that crowns are not done very well. You may not realize it at first. One of the issues where crowns can go really wrong is that too much of the tooth was removed to be able to do your crown. And that's tooth structure you're never gonna get back, and it's needed to hold that tooth together. So another issue where your crown could go wrong has to do with how it was cemented in. So if there's the cement is leaking, or you got blood or other fluids into the cement layer because your gums were bleeding when they cemented your crown, or maybe saliva fluids, that's going to be a weaker bond, and you'll have microleakage, basically bacteria leaking into the crevices, so these little micro gaps of your crown, leading to that crown having premature damage because of decay or because of cement leakage outside of it. So if you end up having bacteria leaking into your crown margins, leaking into the cement layer, that's going to start to have a lot of decay. A lot of crowns are also, they're radiopaque, and what that means is that when we take an X-ray, we don't see through the crown. So if your crown is metal or zirconia, we're not able to see really deeply into the crown. So it might even be missed initially until it gets big enough. But because of the leakage of bacteria into your crown layers, you're going to have decay. You can have really catastrophic structural damage because of that, and you may end up losing your tooth, or maybe we can still do a new crown, but it is going to be a much more compromised tooth at that point. Another common issue with either even fillings or crowns that could cause long-term damage and is often ignored has to do with occlusion, or how your teeth bite together. If your crown is made a little bit high, usually patients can tell that's a problem. They'll tell the dentist, you know, I feel this tooth hitting first. They need to get it adjusted, because if you start trying to bite around it, then you're not really biting in the correct way, you're not chewing in the correct way, and you can damage your joints or you can fracture teeth. But a very common issue with that is that because dentists know that's going to be a problem, they're going to need to see the patient for a post-op. They'll err on the side of making the crown too short. And then because it's too short, the patient's not going to obviously notice a difference when they have the crown put in. But over time, as more teeth get shortened, or you have less teeth supporting your bite, now your bite forces are going to be on less teeth. So the teeth that are biting together are going to have more force on them, and then you can start having problems with your bite or chewing function, and you can have fractured or TMJ problems of your teeth. Teeth, they should not be worn. So a normal amount of tooth wear is about 1 millimeter every 100 years. And about 90% of people have a lot more tooth wear than that. And that's all pathological. Those are things that we need to address, because you're going to be in a position where you're going to have a lot of damage to your teeth that will be difficult to restore later. It's important that when you get dentistry that it's done very well, because once your tooth is cut, that tooth structure is not going to come back. So when something's going to be bonded to your tooth, whether it's a filling or a crown, it needs to fit really well, and it needs to be glued on well. It's important to have the dentist manage any bleeding in the gums or saliva so that doesn't contaminate the surface. Because if that bonding surface is contaminated, it may feel fine for a while, but the problem with that is you're going to have bacteria leaking in and the cement leaking out, and that tooth will be damaged. And a lot of dental offices, I feel, are not really taking the time to do that, because they're having either support staff do the cementation or fillings, or they're just not even taking the time to really eliminate and block any fluids from contaminating the surfaces. So even though you're doing a good job brushing, you're going to get decay in that tooth, and you're going to lose more tooth structure. And the problem with losing tooth structure is that we can never really replace it. We try to mimic it with dental materials, but it's never going to be as strong as it used to be. And it's really important to minimize the loss of that, because once it's gone, that tooth becomes much more compromised, and you'll eventually need to have that pulled much sooner than initially would have been the case. The dental profession is at a crossroads. There are two different kinds of dentistry models. The first one is slow quality dentistry, and the second one is more cookie cutter, high efficiency, high speed dentistry. And the problem with the high efficiency kind of dentistry is that that dentistry may not be made to last as well. You're going to have more failures. There are mistakes involved. There's a lot going on with those offices, because they have to see such a high volume of patients and limit how much time is being spent on this procedure. So it's important for me that that patient's dental work is going to be there for a long time, and it's going to still function and be beautiful for years, or at least the longest we can for the situation that tooth is in.